Estrace cream is a female hormone, active ingredient estradiol. It is used by women to help reduce vaginal symptoms of menopause, such as vaginal dryness, burning, itching. These symptoms are caused by the body making less estrogen. When treating only vaginal symptoms of menopause, products applied directly inside the vagina, such as this medication, should be used first. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risk of side effects due to more estrogen being absorbed. Indications. Estrace is indicated in the treatment of vulvar and vaginal atrophy. How to use. Use of estrace alone or in combination with a progestin should be limited to the shortest duration consistent with treatment's goals and risk for the individual woman. Patients should reevaluate periodically as clinically appropriate, for example 3-month to 6-month intervals, to determine if treatment is still necessary. For treatment of vulvar and vaginal atrophy associated with the menopause, the lowest dosage regimen that will control symptoms should be chosen, and medication should be discontinued as promptly as possible. For women who have a uterus, adequate diagnosis measures such as endometrial sampling when indicated should be undertaken to rule out malignancy in cases of undiagnosed persistent or recurring abnormal vaginal bleeding. Attempts to discontinue or taper medication should be made at 3-month to 6-month intervals. The usual dosage range is 2 to 4 grams. Make on the applicator daily for 1 or 2 weeks, then gradually reduces to 1/2 initial dosage for a similar period. A maintenance dosage of 1 gram 1 to 3 times a week may be used after restoration of the vaginal mucosa has been achieved. Contraindications. Estrace should not be used in women with any of the following conditions: undiagnosed abnormal genital bleeding, no unsuspected or history of cancer of the breast, known or suspected estrogen-dependent neoplasia, active deep-vein thrombosis, pulmonary embolism, or history of these conditions, active or recent, for example within the past year, arterial thromboembolic disease, for example stroke, myocardial infarction, liver dysfunction or disease. Estrace should not be used in patients with known hypersensitivity to its ingredients, known or suspected pregnancy. There is no indication for estrace in pregnancy. There appears to be little or no increased risk of birth defects in children born to women who have used estrogens and progestins for oral contraceptives inadvertently during early pregnancy. Warnings. It is very important that your doctor check your progress at regular visits to make sure this medicine does not cause unwanted effects. Plan on going to see a doctor every year, but some doctors require visits more often. Talk to a doctor if you have high blood pressure, high cholesterol, fats in the blood, or diabetes, use tobacco, or are overweight. You may have a higher risk for getting heart disease. Although the chance is low, use of estrogen may increase your chance of getting cancer of the ovary or uterus, womb. Regular visits to a healthcare professional can help identify these serious side effects early. Side effects. Nausea, vomiting, bloating, breast tenderness, headache, or weight changes may occur. If any of these effects last or get worse, tell doctor or pharmacist promptly. Tell doctor right away if you have any serious side effects, including nausea, vomiting that doesn't stop, mental mood changes such as depression, memory loss, breast lumps, unusual vaginal bleeding such as spotting, breakthrough bleeding, prolonged recurrent bleeding, increased or new vaginal irritation, itching, odor, discharge, severe stomach abnormal pain, yellow eyes, skin, dark urine, swelling hands, ankles, feet, increased first urination.